This is Rosalind Douglas with Central Health Grenada. Central Health Grenada is a grassroots initiative which seeks to educate nationals about chronic non-communicable diseases. And we're continuing today with our series, COVID-19 and those most at risk, because we know that persons with pre-existing conditions tend to have a really rough time if they develop this virus. But we're continuing the discussion and trying to get a better understanding of what's going on with it and how we can create a new normal. And I'm privileged to have with us Dr. Lutz Amechi. He is the Managing Director and Resident Physician of SAMS. Dr. Amechi, welcome.
Thank you for having me. It's a pleasure to be here.
Well, let's jump straight into it, as I know you're super busy, so I appreciate your time. The first question I have for you is it really fair? Is it really fair to say that we are COVID-free in Grenada in light of the danger of an asymptomatic person may pose to spreading the virus among us?
Yes, we can definitely safely say that we are COVID-free right now. And the reason being that despite the fact that you can have asymptomatic carriers, and you do have asymptomatic carriers of COVID-19, we have isolated ourselves and closed off our borders for long enough in that we now have a bubble. Anybody who may have been an asymptomatic carrier in the earlies, which was middle of March when we actually shut our borders, the virus would have worked its way out of them by now, and they would no longer be able to shed the virus. So they are no longer a threat. And if they had been a threat, we would have still been seeing cases popping up here and there. Because despite the fact that statistics say somewhere between 65 and 75% of people who contract the disease are asymptomatic, you will still be able to pass it on to somebody who will end up being sick and presenting with symptoms. But we haven't had any of those. So yes, we can 100% say that we are COVID-free.
Wow. Well, explain to us then a little bit about what does asymptomatic mean as it relates to COVID-19?
Yeah, basically asymptomatic means without symptoms. So you can have the virus on board. You can, just like somebody who has symptoms, spread it by talking, by coughing, by laughing, by singing. You can spread this virus, okay? But you have no symptoms. You have no shortness of breath, no fever, no body aches and pains, no gastrointestinal symptoms, none of the no loss of smell or taste, which is a very mild symptom, but it's a real symptom. You have none of those. You feel 100% perfect. Meanwhile, you're walking around with this virus on board and you're spreading it. If you happen to be an incidental contact of somebody on contact tracing, you're found and they test you, and you feel, whoops, there we go, you test positive, but you've had no symptoms, we classify you as an asymptomatic carrier. And you will be treated the same way as somebody with symptoms, in that you've got to be isolated and retested at a later date.
All right, so even though Grenada has strict procedures in place at the ports, especially, they have segmented colors for different countries when they can come in, their requirements for passengers just before they come in, their procedures when you arrive that you must comply with. Do you think that it's inevitable, though, that we may see a case or two or three or four pop up at different pockets at time?
Yes, and I'll tell you why that is. The incubation period for COVID-19 is anywhere between 3 to 7 days. So let me paint this picture for you. You need to get a negative PCR test 72 hours before departure to Grenada. So you get your test done. That now leaves you 72 hours before you get to the airport. Hopefully you're wise enough to keep yourself isolated from other people, but we know that doesn't happen. And of course, traveling to the airport. Let's say you take public transport. You're on public transport, you could come across somebody on the day of travel and you get the virus on board. It takes you 5, 7, 8, 10 hours to get to Grenada. You arrive in Grenada, you're tested. The rapid test that is done is the first test and the most easiest test to administer, shows negative. The rapid test tells me whether you have developed antibodies to the virus. You don't develop antibodies to the virus until 7 to 10 days after you have contracted the virus. So you see there's a window there. So you're test negative, you come in with your negative PCR, and everybody thinks, okay, this is a clean person, off you go into Gen Pop. So now, this is one of the reasons they've instituted or looking to institute the mandatory quarantine after coming in, so that you then get tested again to see if you have, in that window of that 72 hours, picked up this virus. Okay, and we're trying to isolate you. This is a wonderful idea, but imagine somebody coming here for a week's holiday. As happens a lot. People come here, especially the Americans, they come here a lot for 1 week or 10 days. Well, you're going to spend the entire time in quarantine, so that doesn't really gel with our tourism product. So at some point, that's probably going to be relaxed, and then the window opens for us to see infections in Grenada. But there's ways to mitigate against that. Very simple. The social distancing, number one. We don't need to climb on top of each other. And number two, wear your mask. You wearing a mask cuts down your probability of contracting the virus. Everybody wearing masks reduces the probability to about 2.5% that you're actually going to contract the virus. Everybody wearing the mask and distancing 6 feet and beyond cuts it almost to 0% that you're going to contract the virus. So there's ways to slow the spread of this, but it's inevitable. We will see cases.
It seems so, because even when you take public transportation, you cannot be 6 feet apart from people, although most passengers wear masks, etc.
Yeah.
Well, we have received the information from the Ministry of Health and various health professionals, just like what you were just talking about, washing your hands frequently and wearing a mask and being 6 feet apart. And so, and for several weeks, many of us were at home, could not really go anywhere due to the curfew. So I guess I'm just curious as to, have you seen a reduction of patients coming through SAMS with the flu?
Well, yeah, I mean,
reduction in that?
Of course, number one, first and foremost, this is not flu season. So we're not picking up a lot of that. We saw a lot of flu-like illnesses in January and February of this year, because that, and of course into March, because that's generally the time when we tend to get these things. And we were still getting international travelers coming into the country, bringing their endemic flus from away. We are not going to have carnival, so we're definitely not going to see, because at this point in time, we would have been seeing an influx of visitors, and lots of people would have been getting the sniffles, etc., as happens every single year. But we're not seeing a lot of that right now. And I think just to make your point that yes, we've become a lot more conscious about proper personal hygiene, and a lot more people wearing masks, and that in itself will cut down the transmission of the common flu virus.
All right, thank you for that. Can you reinforce for us again the safety measures a person should take to reduce contracting the virus? Even though, as you say, we are COVID-free in Grenada, we still need to be vigilant. So just for the sake of reinforcement, can you share with us again?
Wear your mask, and wear your mask properly. That means that mask has to cover your nose and your mouth. See a lot of people wearing the mask covering their mouth, but not their nose. So you make sure you wear that mask properly, cover nose and mouth. So you got to keep everything inside, okay? Nose, mouth, cover everything. Second thing is maintain distance, physical distance from people. Ideal is 6 feet and beyond. If you can help it, you be 6 feet and beyond. If you cannot help it, don't speak directly into people's faces. Turn your back on them, turn your side on them, because remember, it's droplet spread from your mouth and your any kind of respiratory spread, and there's little aerosols that you're going to inhale in, and that's how you get the virus. Hands, stay away from mouth, eyes, and nose. Do not touch men. Do not touch men. Mouth, eyes, and nose. Okay? Very important. If you do not wash your hands, do not touch any of these structures. Until then, you're going to be fine. It's very important that we remember those things and we continually do them, because this way we minimize the probability of contracting the virus. We minimize the probability of transmitting the virus if we have it and do not know. But on top of that, it allows our health systems to cope with the cases we do get, because we're small, we're very limited, and we don't need to be overwhelmed. You know, one case in hospital is one case too many, to be honest.
Well, my final question for you, as Central Health Grenada deals with persons who have existing conditions, non-communicable diseases, what advice do you have for persons with an existing condition as we go through this phase of a new normal dealing with COVID and all the other communicable diseases that are out there?
I think this time, more than any other time, even though it's something they should all be doing, it's very important that you take your illness seriously. You do what you have to do. Your hypertension, control it strictly. Your diabetes, make sure you look after that diabetes and you keep yourself as optimally fit as possible. In other words, keep your blood sugar under control, keep your diet well under control, keep your exercise going. But more importantly of all, if you know that you're in a high-risk group, that is anybody with a non-communicable disease, anybody that has any sort of underlying illness, people with cancers, heart disease, diabetes, all of that, stay away from large gatherings of people. Maintain your physical distance from people. Wear your mask properly. Very important.
Dr. Lutz Amechi joining us today from St. Augustine Medical Services. He is the managing director and resident physician giving us advice today. Dr. Amechi, thank you so much for your time today, sir.
You're very welcome.
Okay, soldiers. COVID, please leave us alone.
COVID, please leave us alone.
All of us are staying home.
All of us are staying home.
I know you want to see us dead.
I know you want to see us dead.
You're staying home so you won't spread.
You're staying home so you won't spread.